welcome to the Smart Medical Academy. And we are continuing with the second part of the anatomy, and the second lecture is joints classification. And let us know what is meant by a joint. I think most of you would have been known that it is a junction between two or more bones or cartilages. It is a device to permit the movement like flexion, extension, and only the exception is the hyoid bone in the body. Except the hyoid bone, every bone in the body is connected to or forms a joint, but the hyoid bone doesn't form or is not connected. What is the main function of the joint? It holds the skeletal bones together and allows the skeleton some flexibility, so gross movement can occur, and also the bone growth is also possible. So there are many kinds of joints, and we will be learning more deeply regarding the classification of the joints because it is the most important topic. Joints are classified into structural and functional. Structural classification is determined by how the bones connect to each other, while functional classification is determined by degree of movement between the articulating bones. For example, the structural classification means how each bone is connected to each other. For example, ball and socket joint. How it is connected. One acts like a ball and other acts like a socket. And also the hinge or plane, etc. And functional means what is the degree of movement. Based on this, it is divided. So now coming to the classification of the joints. Joints are mainly divided into three types, that is fibrous or fixed. Just remember F and F. Fi. So fibrous or fixed. So this type of joints are known as synarthrosis. Cartilaginous, it is slightly movable and it is known as amphiarthrosis. Synovial is free to move and it is known as diarthrosis. So now the fibrous or fixed, also known as synarthrosis, is divided into three types. Number one is sutures, gomphosis, syndesmosis. Sutures is between the cranial bones and gomphosis between the tooth and socket. Syndesmosis means between interosseous membranes. For example, the middle radio-ulnar joint and the superior inferior tibio-fibular joint. Actually, this page or this slide which you are watching right now is just an overview of the entire lecture. You will be watching each and every joint so that you could get a clear idea of that. So just have an overview and we will go into the deep knowledge. And amphiarthrosis is divided into primary and secondary. The primary is known as the synchondrosis and it is a temporary type of joint, and symphysis is a permanent. So just observe, does these words in these words, which word has a P in it? Only the symphysis has the P and hence it is permanent. And synchondrosis doesn't have any kind of P and also it's starting with the T. So it's just remember one thing and it is exactly opposite one. And the examples of the temporary cartilaginous joints are the first costosternal joint between epiphysis and diaphysis. The permanent joints examples are pubic symphysis, menobriosternal, and intervertebral joints. These three are the examples of the symphysis, and these are all comes under the category of the amphiarthrosis, which moves slightly. Synovial or free, it is a diarthrosis, and we have 6 type of synovial joints. We have 6 types of synovial joints. The first one is easy, that is ball and socket, which is shoulder and hip joint, and the second one hinge or ginglymus. The 3 joints are the examples of it, which are the one elbow and interphalangeal joint, ankle. Third one is pivot or rotating. We have 2 examples in it. The superior inferior radio-ulnar joint. Actually, I think you might have been getting it out. The middle radio-ulnar joint we have studied here, and it comes under the syndesmosis, under the main classification as synarthrosis. So just compare while you're reading, you won't get confused. And the second example under the pivot or rotating is atlantoaxial, and it is known as the no type of movement, just nodding your head horizontally, not vertically. No. Just to remember, axial, it has an X. So if anything we don't want, we just strike it off like X. So axial is a no moment. Condylar or ellipsoid movement, sorry, condylar or ellipsoid joint. It has the examples of atlanto-occipital. So occipital is yes type of movement, moving your head vertically, and the wrist joints like radiocarpals, and all metacarpophalangeal joints, temporomandible, knee joints. The knee joint, we have two different kinds of knee joints. The knee joint which is formed by the condyles of the femur and the tibia comes under the condylar, but the knee joint which is formed with the lower end of the femur plus patella comes under the saddle or sellar type of joint. So the fifth type is plain or gliding. It has three types: IC, IT, AC, intercarpal, intertarsal, acromioclavicular. So just remember, it is a plane, and the three words and the short form are written inside it. Inside the plane, we usually feel it as cold, so we have an AC in it, that is acromioclavicle, and we also have an IC, it is intercarpal, and IT, it is intertarsal. Just remember this diagram, and you will be having plane or gliding examples with you. The saddle or sellar joint type of joints, we have first carpometacarpal first carpometacarpal joint, yeah, and the sternoclavicular joint and the knee joint, as I said earlier. So this is an overview of the joints classification. Just go through it slowly once again, and it is an easy one. There are many examples, and they will be giving, like for example, the tooth and socket joint is, or else the gomphosis joint is, which of the following is a gomphosis joint, and which of the following comes under hinge joint, and or else all of the following are condylar joints except. So you have to be perfect with this table, practice it, and you would get it. So let us see the diagrams quickly and in this lecture, because we have to give our credit more time to other topics. So this is again the clear table. So the fibrous joints, as we the first classification, fibrous or fixed. We have the sutures, also known as synostosis, means between the bones. So these are the sutures, suture lines and suture joints. And we have different types of sutures, and one medial palatine suture, interparietal suture. Between the temporal and parietal, we have squamous sutures, and these are different kinds of sutures. Actually, in view of MCQs, you need not remember all this. Just you go and remember the previous classification which is written. And syndesmosis, these are the syndesmosis joints, the middle radio-ulnar and superior inferior tibiofibular joints. Gomphosis, it is the joint between the tooth and the socket. And the cartilaginous joints, we have two types, primary and secondary. It is just slightly movable joints, also known as amphiarthrosis. And the primary cartilaginous was synchondrosis, means they were temporary, because this word doesn't have a P in it. So we go with the temporary ones. So these are the temporary joints. As I earlier mentioned, like the sternum, the first costosternal joint, the first costosternal joint is a primary, that is synchondrosis joints, and the secondary cartilaginous joints known as symphysis. We have a P in it, and it hence it is a permanent joints. And these are all the examples of this. For example, the pubic symphysis, intervertebral joints. So these are the intervertebral fibrocartilaginous intervertebral discs, and that's it. And these are the synovial ones, which are freely movable. And we have already covered all these joints, like they are of 6 types. This is a plane joint, like I think you have to remember, plane is an aeroplane. So inside the plane we had AC, IC, IT. So just check it once: intercarpal, intertarsal, and acromioclavicular. So these all comes under the plane. And this is a hinge joint, which is the elbow joint. Like hinge means it looks like this: the elbow joint, the knee joint, and interphalangeal joints. Pivot joint. Pivot joint, we have already read it: superior inferior radial ulnar joint, and also the atlantoaxial, that is no joint. So this is the superior part of the radial ulnar joint. We have the pivot movements and the condylar joints, and this is the temporomandibular joints, knee joints, and also atlanto-occipital, that is S kind of movements. Actually, the condylar permits the movements only in two directions. Ellipsoid joint. Ellipsoid means that is wrist, atlanto-occipital, metacarpophalangeals, and metatarsophalangeals. Just don't confuse with all the matter which is written here. Just have a look at the diagrams and have a look at the previous classification which was written. That's it. Remember the examples and the type of joints. Just to get understanding, just watch at the diagrams and leave this. That's it. And the functional classification, we have already covered all this, and that is synarthrosis. They are the like sutures, fibrous or fixed ones, amphiarthrosis, cartilaginous ones, diarthrosis, or the synovial ones. It has two articulation surfaces, that is a simple joint. And if it has three or more, that is, for example, if you see the radiocarpal joints, you have three or more articulation surfaces. The complex joint is a knee joint, also has three or more articulation surfaces plus an disc, an articular disc or meniscus. Then it is known as a complex joint. So what are the parts of the joints? It is not at all an important one, but just that for your information, I have already mentioned it. Please go through it. And thank you. That's the end of the second lecture. Hope you will remember with few mnemonics all the classification of the joints, and don't get confused when you attempt the MCQs. And once again, I am emphasizing that the revision is a key to the success. So please revise. Don't forget. Thank you for watching.